good morning. My name is Vega-Velez, also known as Jay. The focus of my presentation is Sturge-Weber Syndrome. It's a rare neurocutaneous disorder. I selected this condition because my best friend, Cameran Masters, suffers from it and continues to manage the challenges associated with the disease. My objective today is to provide an overview of Sturge-Weber Syndrome using medical terminology, a lay explanation, and explain the medical aspects of the disorder and its impact on individuals living with it, like my friend Cam. Sturge-Weber Syndrome, also known as encephalotriennial angiomatosis, is a rare congenital disorder characterized by capillary malformation, which is a port wine stain, and abnormal artery growth that occurs in the cerebral cortex, the brain surface and skin. It is classified as a neurocutaneous disorder. The disease is an eponym that is named after pathologist William Allen Sturge and physician Frederick Parks Weber, who specializes in dermatology, pathology, and general medicine. Sturge-Weber syndrome is caused by a somatic activating mutation in the GNAQ gene, which affects blood vessel development during early embryogenesis. In other terms, this syndrome develops before birth when a gene mutation causes abnormal blood vessels to form in the brain and skin. It is inherited but occurs randomly. Their neurological complications arise from the leptomeningeal angioma, an abnormal cluster of arteries covering the surface of the brain. This leads to chronic hypoxia and cortical calcification, which can result in recurrent epileptic seizures, hemiparesis, developmental delays, and sometimes status epilepticus episodes. Due to the abnormal blood vessels in the brain, the person may have repeated seizures, weakness on one side of the body, and difficulties with learning or movement. Ocular involvement is common and includes glaucoma, ophthalmos, and choroidal hemangiomas. Dermatologically, the hallmark is a facial port wine stain, usually following the distribution of the trigeminal nerve. The extent of facial involvement often correlates with the severity of brain and eye complications. So in other terms, most people with this condition have a reddish purple birthmark on one side of their face and sometimes eye problems that can affect vision. Diagnosis is primary clinical, but supported by imaging and ophthalmologic evaluations. Magnetic resonance imaging, also known as an MRI, with contrast identifies leptomeningeal angiomas, while computed tomography, which is a CT, may show calcification in the cerebral cortex. Ophthalmologic exams detect glaucoma, and genetic testing may confirm GNAQ mutations. In other terms, doctors use MRIs and eye exams to confirm the condition and look for abnormalities or changes in the brains and eye. Treatment is symptomatic and multidisciplinary. Anti-epileptic drugs are administered for seizure control. Laser therapy, such as pulse dye laser, is used to lighten port wine stains. Glaucoma is managed with medications or surgery. In refractory cases, neurosurgical procedures such as focal resection or hemispherectomy may be considered. There is no cure, but seizures and other symptoms can be managed through medicines, surgeries, and laser treatments for skin and eye problems. The prognosis depends on the severity of neurological involvement and response to therapy. Early onset seizures, extensive angiomas, and uncontrolled glaucoma often predict a poor neurological outcome. Lifelong medical follow-ups is essential for optimal management and quality of life. The outlook varies. Some people do well with treatment, but others may continue to have seizures or vision problems and need lifelong care. Chronic disorders such as Sturge-Weber syndrome also impose psychosocial burdens on families. They may experience caregiver fatigue, financial strain, and emotional distress. Access to multidisciplinary support, such as neurology, dermatology, ophthalmology, and psychology, is essential for improvement patient outcomes and family well-being. The condition affects not just the person but also their family and friends. It takes a strong support system to manage the medical and emotional load of this disease. Sturge-Weber syndrome has significantly impacted my best friend's life, Cameran Masters. From birth, doctors gave her a grim prognosis. Frequent seizures during childhood significantly disrupted her school attendance and hindered her cognitive and learning development. In addition, she experienced aphasia, which, compounded by the presence of a distinct unilateral portwine birthmark, blepharotomatosis, and facial edema, made her a frequent target of persistent bullying. Repeated hospitalizations for seizure control, chronic pain, and ophthalmologic monitoring have created both emotional and physical challenges. At this time, Cam is supported by a multidisciplinary team of specialists, including a Sturge-Weber expert from Boston Children's Hospital. Her physicians regard her case as an anomaly, given the extent to which she has been able to achieve personal goals and maintain a relatively normal quality of life despite her diagnosis. Recently, she has had an ischemic stroke in the occipital lobe, which resulting in losing her peripheral vision, causing partial blindness in her right eye. A routine ophthalmologic examination where a tonometry intraocular pressure test was performed regarding the state of her glaucoma. Further review revealed she had a detached retina. A consultation with neurosurgery suggested that a corpus callosum should be considered if all anti-epileptic medications are exhausted. It is an incredibly invasive surgical procedure in which an incision is made to sever the corpus callosum, which is a bundle of nerve fibers that links the two hemispheres of the brain. The objective is to minimize the transmission of seizure activity from one side of the brain to the opposite side. Despite these obstacles, Cam remains resilient. She graduated with a bachelor's degree in science and biology in 2020 and continues to pursue higher education in hopes of attaining her Doctor of Pharmacy, PharmD, degree to become a licensed pharmacist. She demonstrates remarkable perseverance and grit by actively engaging in social events and cultivating meaningful relationships with elegance, optimism, and strength, despite enduring the stares and occasional comments of passerbygoers. Watching someone I care about manage such a relentless condition has been difficult and inspiring. It has taught me empathy, patience, and a deeper understanding of chronic illness. At the same time, it can be emotionally challenging to witness her struggles, knowing there are moments I cannot ease her pain or change her circumstances. Yet these challenges have strengthened our friendship as I have witnessed her resilience, enthusiasm, and determination to live life fully. Being by her side has not only deepened my appreciation for her strength, but also motivated me to approach my own obstacles with greater perseverance. In conclusion, Sturge-Weber syndrome is a rare but complex neurologic and cutaneous disorder with lifelong neurological, ocular, and dermatological implications. While there is no cure, ongoing research and multidisciplinary care continue to improve patient outcomes. This condition has not only affected my best friend's life, but also has deepened my understanding of the human capacity for resilience and adaptation.